Good morning, everybody. I am on live here with the Dr. Dallas Clinic. Thank you, everybody, for holding on for us. We had a small technical issue, so apologies for the delay. I'm Tina. I'm new to the clinic with Dr. Dallas. We are just in the process of getting our gorgeous model numbed up, so you can come with me now as we're just going to get the PRP ready for the Morpheus. So here we go. We are opening up. Sorry now. Now, here we go. So this is our blood that we took earlier on, and this is all the nutrients of the PRP that we're going to use at the end. So we have our bottle ready, and we're going to come into Dallas now as he just gets the lovely Pamela ready. Oh, 1 second, guys. Wrong one. Tell nobody. Wow. Now, here we go. So, Dallas, do you want to say hello to everybody?
All right, good morning, everyone. How are you? So we're just finishing getting some local anesthetic in here, because we like to take the pain out of all these procedures. So I try not to show you the stuff you don't want to see. So we use both topical and local anesthetic to just really enhance the numbness so that the procedure is as comfortable as possible. The caveat is there is a little sting when anesthesia goes in, but it's very short-lived and very worth it. So we've got most of it done now. We're just making sure that all the bits are nice and numb so that Pam can just comfortably relax into the treatment. The longest part of the treatment is the local anesthetic. So as we get this into place, it just puts Pam at ease and makes her ready to go ahead. So that's why for all these treatments, we'll bring you in an hour before we actually start the treatment. Treatment itself is going to take around 15 to 20 minutes, and the prep is about an hour. So it's well worth the wait. Plus, if you're comfortable, it makes doing any procedure that much less scary. So we're almost done here.
And Pam, how are you feeling through it? I won't put the camera just on you just yet, but are you feeling okay?
Yeah, it's just as he describes, it's a tiny pinch, but then that's it.
That's great.
Even nice and numb.
And the other thing we can do is we can always add more anesthesia. If it is uncomfortable, it's easy to add more anesthesia in. So you can always talk to us throughout the procedure and you're getting everything ready. So we're almost there now. So the face, Pam, when she first came in, had her face cleansed and then a local anesthetic cream is applied. We don't just use any local anesthetic cream, we use the rocket fuel local anesthetic creams. So we want you to be as comfortable as possible. And so this is great stuff. And really, the treatment probably can be done with less anesthetic, but if you can be more comfortable, then why not? So that's what we're gunning for.
Obviously, the less pain, the better for everybody.
The less pain, the better. Same way we do lips with the dental block. I want you to be comfortable in everything we do. So let's talk about a little bit about Morpheus itself. Morpheus is a radiofrequency microneedling treatment. And what does that mean? So radiofrequency is a type of energy. And so it will heat up the tissue and cause little micro traumas underneath the skin itself, which will cause tightening and firming of the skin. So right now we're just cleansing the face, making sure they're nice and clean. We use a product called Clinicept for this. We've taken the blood already, and we'll show you a little video when we post this up later to show you how we get the blood, and then we can show you the liquid gold which we're going to put on the face after. So I think that is good and ready.
Pam, how are you feeling?
Numb.
Yeah, are you feeling numb?
I feel like I don't know whether I'm going to be slower.
Oh yeah, that feeling of like a gentle block.
Yeah.
So this here, this is our liquid gold. The stuff on the bottom, we don't need that. That's good for your tissues, doesn't do much for the skin itself. But this gold and stuff here is your platelet-rich plasma, and that's what we're shooting for. That's what does the magic.
I have a question here from one of the followers from LP Sweeney asking, does it have a tightening effect, this treatment?
So yes, Morpheus is a skin tightening, skin firming treatment. So that's exactly why we use it. So this is the Morpheus gun itself, okay? And this is the 24-pin tip. What makes Morpheus unique as far as microneedling radio frequency goes is these little pins emit their energy at the tip, and it's all absorbed by the plate here. And what does that mean for you? That means it's more comfortable. We can deliver more shots, which means we can get a greater stimulation to the skin without you being uncomfortable. Just as a demo on how this guy functions, I'm not sure how. So as we press the pedal, let's see, set this up. We can be dramatic. We don't go this deep in the face, but this is how it works. So when I press the pedal, the little pins are going to pop out, and they deliver the energy that quickly. So you're going to see as we kind of go around the face, there's going to be a bunch of shots around the face. And it does happen quite quick. Bear with me now as we get it all set up and ready to go. And we have Pam already.
Here we go.
Alright, this is Pam's first time having Morpheus. And so we always test. We want to make sure you're comfortable as we're going. So we're going to start just nice down to the chin here. And we're going to deliver a little shot. 1, 2, 3, pinch. She hasn't flushed, so that's good. So we know she can tolerate the energy, and then we can push it on just a little bit, so we get the most out of every result. So we go again. And if you're uncomfortable at any point, you let me know, because we can add more anesthesia. So in and out. And we just work our way around.
What's the difference in the depth that I would get with the microneedling?
So microneedling, we don't tend to go a depth beyond around 1.5 millimeters, whereas here we're going all the way to 3 millimeters. And so we're just going to go with a bit of overlap to deliver all these shots to the neck, and then we're going to move on to the face. So what we do with the PRP is once this is done, we'll put PRP on, and that's going to help with the healing, but it's also going to help bring down the redness. So we want to use multiple modalities to get the best results we can.
How's that for you, Pam?
I'm shocked how painless it is.
Amazing.
And so like even without the blocks, it would be mildly uncomfortable, but it shouldn't be excruciating. And if that is, then we need to really look at what we're doing in the depths, and we can make adjustments to get the most out of the results. So you can see with every time we make a pass, you can see the skin contracting in.
And Dallas, what would be the downtime? Somebody's asking there, what would be the downtime after having this treatment?
So the advantage of Morpheus is most of the trauma is underneath the skin. So our downtime is really minimal. We do say that up to 36 hours you could have some redness, some itchiness to the skin, and that's all part of healing, like any kind of wound. But we use either SkinCeuticals Hydrating B5 serum. You can use that as much as you want. Or even Vaseline can kind of help keep it clean, protected, and hydrated. So it will feel a bit like a sunburn.
Dallas, I thought you said gasoline.
No gasoline.
Vaseline.
Vaseline. Mind my Canadian accent. How we doing, man?
Yeah, all good.
And I've one other question coming in saying, how long do the results last?
So when we first start Morpheus, when you've never had it before, we do a course of 3, and they're about 4 to 6 weeks apart. my focus too.
Sorry.
4 to 6 weeks apart. And the results will last. It's not a permanent change to the skin. The skin is a living tissue and it's always going to continue growing. Here's a nice divide. You can see we've treated the right side of her neck versus the left. So we've got some redness, you know. So
I'll just go in and show the redness. There you
You
go.
can see we've got good coverage. We've covered all our areas, good overlap. We're ready for the lips. So it lasts about a year. So after you've had your course, we recommend 1 session of Morpheus a year just to maintain the results. But we'll also combine it with Profilo to kind of treat and hydrate the dermis in between, after the Morpheus sessions.
And for those that might not know what Profilo is, do you want to just maybe...
So if you don't know Profilo, then you haven't been watching me long enough. Profilo is amongst my favorite injectable treatment, and what this is, it's a skin bioremodulator. So what that does, it helps refill the dermis with hyaluronic acid that gives the architecture back to the skin. And because it's a hyaluronic acid, it draws a lot of water, so you get a lot of hydration and glow to the skin, and helps plump out kind of crepey lines.
So the combination of both is excellent then.
Oh, it's ideal.
Still okay there, Pam?
Oh, good.
I have another question here from Adele. Hi Adele, is the Profilo included in the Morpheus package?
So they're separate treatments, but we do have different package with Profilo that will continue on, that'll kind of take some of the bite out of the expense.
Yeah.
But we'll get into that in a bit.
Just going to show you another angle. You certainly look very comfortable, Pam, on you, which is great.
Yeah, it's less painful than anything else that I've gotten done here.
So to Bunsell, the downtime, Dallas just addressed that a couple of minutes ago. You might not have been with us at that time. So about redness on the face and about 36 hours in total for the downtime after this treatment.
Also, being our first live demo, into the comments or into the DMs, we want you to type in a DDC24, and that's just a special celebration of our Morpheus. We're moving on to the face.
So it's DDC, isn't it?
DDC24.
No 24, just
No 24, just
DDC. So if you want to write DDC into the comments, you will get a series of messages from us that will give you a little something special. Oh, guys, these are all on the ball with the DDC.
So now we're just going around the right face here. So we're going to do 2 passes in
I'll go
the
around this side again.
in this kind of in the neck and the lower face. Around the lips and the more delicate areas, we do it slightly differently. Let's see, just about 3 millimeters. We want to get all that skin. So even here, we're going to pull up and make sure we get all the skin on the jaw as well.
Will it help the appearance of the jawline?
So when we tighten up the muscles, so why Morpheus is very popular is it's a great treatment for the jowls and kind of improving the appearance of the jawline.
And Pam, you're getting a compliment here saying your model has lovely skin.
Will you turn towards me, Pam? Yeah.
Okay.
We do the other side.
That's all thanks to us.
Come back around so you guys can see.
You gotta remember this is a little bit slower today because I'm trying to teach at the same time.
wrote Daddy DD. Not sure what the reference is. I don't think that's going to get you the gift. DDC. For anybody who's just joined, if you want to type DDC, Dr. Dallas Clinic, you will get a series of messages for a special gift with this treatment.
So with every shot we're giving it, so the 24 pins go in. So we're going to have a total of about 750 shots when we finish the treatment completely. And this happens very fast. But it gives a lot of micro traumas to the face, which is going to contribute to that healing cascade, and the areas of treatment really kind of get stimulated. Just to make sure we get it all.
Yeah, it's very clear, isn't it, when you see the lines, the skin is the redness from it.
So that's the whole lower face, and then we call this in the fixed mode. So it kind of gives a double shot. Now we're going to do a cycle mode, which is slightly quicker, but to hit the next layer up.
You feeling okay, Pam?
Yeah.
Yeah? Nice and numb?
Tight on.
Turn around and look at me here and just see.
So it's great redness, great
Yeah.
distribution. We're going to get a great result off of this. So this is cycle mode, which is slightly quicker, and you'll see as we go, we're going to fly around. So that's kind of the longest part of the treatment, is doing the fixed mode around those kind of more tissue-y areas. So this is cycle mode, so we're a little bit shallower, and we're hitting the dermis on this one. So you see we go in.
Feel free to ask any questions, anybody that's with us live, and Dr. Dallas will be happy to answer any questions that you have.
You see on the side, this goes a lot quicker.
So somebody that just joined us asked, how long does the treatment take?
Typically, about 15 to 20 minutes.
Just
15 to 20 minutes, but you're about an hour kind of prepping, getting the anesthesia, getting the blood taken, getting the skin nice and numb.
This one feels different to the other one.
Yeah, so it's a bit more superficial in this one. So it's kind of a sensation different, a little prickly sometimes.
And is there anything you should avoid doing after getting the treatment done, Dallas?
So we want you to protect your skin. So your first kind of 2 days especially, you want to think of it as kind of a wound that you're protecting. So keeping it hydrated, using the hydrating B5 from SkinCeuticals as much as you like, keep you comfortable. And then, like all aesthetic treatments, anytime you interrupt the skin, SPF is so important.
Would you recommend SPF 50 then?
Oh, always.
Always.
If it's bright enough to read, it's bright enough to have SPF on it.
I saw a post recently of a woman, and she was in her 80s, and who had used SPF 50 on her face her whole life, but had never used it on her neck. You didn't see that post, did you?
I've seen that.
Did you? Mm-hmm. And her skin was incredible, and then her neck down, you could see the aging process had really taken its toll on her neck down. It was such an amazing example of the importance of it. Still pain-free, Pam?
This one's a little bit more than the other one,
Okay.
but it's
Bearable,
fine,
manageable?
yeah.
In any procedure, you're always going to be aware something's being done, but we always try to keep the pain to a minimum. So this is the quick one. This is the 2 millimeter depth working.
I have another question for you, Pamela. What can the model feel? What is the actual sensation feel like?
Like if somebody's flicking my face.
Flicking.
For this part, whereas the first time I didn't feel anything.
Okay.
It just felt like the pressure of the gun.
Okay.
Is it the same amount of needles that's going in here?
Oh yeah, it's still 24 24 needles, but they're not going as far. So why you feel a different sensation is because the needle depth is different. And so the energy, when you're feeling the energy at a different level, like little needles are so tiny. But when you feel the energy, which we turn down a little bit, because we don't need as much energy for the dermis, and we're not going to do something that's unnecessary.
Yeah, because this one seems to feel like there's like 4 bigger needles, whereas the other one felt like it was smaller.
Right.
For some reason, I don't know. But definitely feels different towards the first one, but it's totally fine.
So that's everything we do with the prime, the 24. So now what we're going to do is we're going to switch to a 12-pin tip. We're going to do areas around the eyes, around the mouth, and around the forehead. So the neck and the other part of the face is now done.
I probably just have the camera on you there, just to see. Looks good. So Dallas, can you talk through exactly like the kind of treatment, what it can address? What does it address, this Morpheus 8?
So Morpheus is skin tightening, skin firming. So this is great with scarring, like any kind of old acne scars. When you traumatize or microneedle through them, it helps kind of plump them back out and kind of resurface. So it's going to improve your texture. It's going to reduce scarring, and we even can use it over kind of post-surgical scars to really break them down and make them less evident. For the average person, what we're using this for is to really keep the firmness of the skin. So as we age, our skin quality decreases, and it's a kind of a natural process. And so by causing these little micro traumas, we're tightening the subdermis, or the subcutaneous space, which is kind of causing little burns within the fat, which will get rid of a bit of fat, but it's not its main purpose. So these little contractions, these little micro traumas, tighten from the subdermis and then into the dermis, and then a little bit up through the epidermis. And if we're approaching something like scarring, we really focus on the more superficial layers as well as the dermal layers. As scars are deeper, they can be harder to treat. So it's a nice way to kind of break them up and cause the healing cascade to kind of fix and smooth them out.
And for people that have large pores, it's helpful for this as well?
Yeah, so, pores is a common complaint. And, when you're tightening the skin, you're going to help also shrink out the pores. So it's a nice little benefit of the Morpheus treatment. All right, so we're going to cycle. So this is just the more superficial depth. It's the quick little shots. Okay. So this is a more tender area of the face, and with the 12 pins, it just gives that better control to kind of really get in there. And speed isn't the key. It does help from a discomfort point of view to know it's going to be over quick, but precision is what really matters here.
One other question on the DMs, does it help hyperpigmentation?
Does it help hyperpigmentation? I guess we'd have to kind of discuss what the base for your hyperpigmentation is. Needling through, this is more skin tightening. It's not addressing pigmentation issues as much. Like it will be similar in the epidermal pigment, which is the pigment in the top layer of the skin. But for the deeper pigment issues, we probably need to talk more about kind of peels and really topical agents like hydroquinones and things like that. So pen is tough here, but the upper lip is a bit more tender, and so sometimes we need to add a little extra analgesic across the upper lip to do that.
I was actually worried about that, and it actually was fine.
Very common concern. And so then we're going to go around the eyes. We'll do the eyes last.
Yeah, that's my major area of concern is my eyes.
Like any procedure that involves needles as well, we talked before we went on to the live, but as part of consent, we tell you that bruising can happen. Anytime you pass anything through the skin, you can get a bruise. Obviously we try not to, and we avoid major vessels, and we're not really hitting depths where most of the bruises will occur. But it is a risk. You could get a bruise. And if they're going to happen, largely they happen around the eyes.
There's another question in from Winnie. Does it work on older skin over 60?
So it's very case by case, because some in their 60s, like Winnie, has incredible skin. So it's very beneficial. But anytime we do a treatment like this, we're going to discuss all the options, even the options that I don't offer. So sometimes if a surgical consult is something that we consider, we'll talk about that. Because it's more important that I send you for the treatment that is best suited for you, rather than just doing a treatment because I offer it. And that's where consultation pre-Morpheus really comes into play. Thanks, Woody.
And another, could Morpheus be used instead of filler for slightly sagging skin?
This would be very case by case as well. And I guess it depends where the sagging skin we're talking about. Sometimes filler is a good option, but for me, skin quality will always be priority one over volumizing.
And I suppose people coming in for the consultation you're all welcome to come in and discuss with Dallas if this treatment would be an option for you and if it is the best option for you.
So the angle's not going to be good for you here.
No problem. I'll just give everybody a reminder again. If you've just joined us and you want to type in DDC, you will get a series of messages from us and you will receive a special offer on the Morpheus 8. So DDC.
So we're getting under the eye here, which is it's a hard angle to record.
Yeah, I'll just go around here.
But we're being very safe and staying away from the eye itself. So we drag the skin down so we can get as close as we can. So we get the probe on and move towards the bone. So you see,
That's me going.
it's a little surprising.
It wasn't the pain, it's just I can know it's on my eye.
Yeah.
It's the location.
Yeah.
It's the same for the upper brow here. So we're going to lift up. We don't want to be on the hair because we don't want to cause any burns. We give a little good position. So this thin skin does not require as much trauma because it's very thin, so we're just moving energy to that dermal layer. Very delicate.
How's that, Pam? Is it okay?
Yeah. I was worried about this too, around the eyes, because it's so sensitive, but that was fine.
Get some nice erythema. And now we just have the forehead left. So we're going to fly around the forehead. And so I put in injections into Pam's forehead here of a little local anesthetic, so all this area should be nice and numb. It's a strange sensation because we do hear through the air and through our bones. So when you're close to bone, it can often feel because you can hear. So we don't treat over hair because energy is going to burn hair.
Nobody needs that.
Gotta hold on to those precious babies.
Yeah.
Yeah.
And I'm going to do the other side.
Come over this side.
So overlapping the skin and first going over.
How's the forehead, Pam?
Yeah, totally fine.
Totally fine. It's great. You can actually, if we zoom in, you might actually be able to just see. Oh, that's it. Oh, sorry, my shaky hand. You can see the tiny needles just penetrating there. No. Wow.
So that's the end of the Morpheus. So we've given 650 shots. The maximum we'll give it 750, but that tends to be if we're coming down the décolletage a bit more. So the face is all nicely traumatized. You can see she's nice and red all throughout. These little white patches, there's a little bit of adrenaline in local anesthetic, so we can see where we've gone in with the local anesthetic.
Pam, do you want to turn around and look at me? How are you feeling?
Yeah, good.
Yeah?
I might look a bit crazy though.
Thanks. Okay.
So there's no more needles. The traumatic, everything about it, which was very little, is all done. So now we're just going to drop some liquid gold and spread it around the face. It's one of my favorite parts. This is where we make a mess.
This is from the blood taken earlier on. Just for anybody that only joined.
So I have a needle on it, but it's not going in, it's just to distribute. So we're literally just going to put the PRP onto the skin. And this feels nice and cooling. You just give it a nice rub in.
So for anybody that just joined, we took some blood from Pam earlier on and we separated out the plasma. How does that feel on the skin, Pam?
Yeah, feels great.
And Dallas, do you want to explain what this will do for the skin as well, for anybody?
So what the redness we're seeing from underneath is her body bringing blood, or erythema is blood being brought to the surface, based on the trauma that we've caused. Controlled trauma that we want. And so we're just giving a really kind of concentrated dose to the areas that we've just created all this trauma in to release the platelets. And platelets are going to give growth factors and interleukins and all sorts of kind of healing benefits to really enhance the process. As we spread that all into the skin, we're going to keep going until it's all gone, because we don't waste liquid gold, do we, Pam?
Definitely not.
So PRP has multiple applications all throughout medicine. In aesthetics, we use it largely for kind of hair regrowth and to kind of stimulate the follicles so that they can grow nice healthy hair and stimulate the follicles beside them. For the skin, we use it for its kind of healing and regenerative properties. Because in general, the skin doesn't get this kind of quantity of the good stuff. So that's where we're at. So we're gonna let this kind of soak in. And then to finish it all off, we're gonna put a little bit of seal of Vaseline on, just to keep that on. And we're gonna keep the PRP on the face till tomorrow morning. So a clean pillow, but a pillow you don't care too much about because you're gonna wash them tomorrow.
Do I look as bad as if I've gotten PRP or?
Very similar.
Okay.
Very similar, less bloody.
No.
So
Yeah,
we're
you
gonna-
look fine. Your face will look a little red, but if you were to walk down the street, I don't think anybody would be too shocked or...
Yeah. I have
Neck.
sensitive skin anyway. So
Yeah,
once
the
you touch
neck
my
is
skin,
a little red.
Okay.
I'd have similar skin to you.
And we call it Irish skin.
Yeah.
And proud. Irish and proud. Get all that goodness. So that's a good kind of 4 mils of PRP there. And
So just don't wash my face till tomorrow morning?
you're not going to wash your face till tomorrow morning. So we give it a good cleanse. Now we put the PRP on. So it's kind of, I think of it in my own head as if anyone's done any landscaping or anything like that, when they aerate the lawn, they create little holes. Basically, we're plugging all these holes with PRP. We let that all heal up. That's going to dry over the next kind of minute or two. We're going to put a layer of Vaseline on. And then for the next 2 or 3 days in particular, we're going to give Pam the SkinCeuticals Gentle Cleanser. So she's going to clean her face once or twice a day with that. And then use the hydrating B5 serum as much as she wants. And it's going to keep the skin feeling nice and hydrated and take some of that kind of sunburn feeling out of it. So that's all gone very well. SPF, SPF, SPF. We're always going to keep applying SPF. Not today. Hide from the sun today. We don't want to put any kind of creams onto kind of freshly treated skin. What else do I have to tell you?
Any alcohol?
We'll avoid the booze. Avoid the booze tonight. It's not a strict rule, but it's always a good idea after any procedure to kind of reduce your alcohol intake. Just let yourself heal. We are going to do this again in about 4 to 6 weeks, and then again 4 to 6 weeks after that. What Pam's going to experience over the next kind of 24 hours is sometimes as the skin's healing, as it's tightening, it can feel a little bit itchy. And this is a natural histamine response from kind of traumatizing the skin like that. Antihistamines, so like you take for an allergy, they can help kind of take that itch down by controlling the histamine reaction. Very few people need it. You're going to feel kind of a tightness over the next couple of days. And as we stimulate the healing cascades, the skin is just going to keep getting better. And it's a compounding benefit. That's why we do a course of 3 initially. So as the collagen is stimulated, as the skin is healing, it does a lot from a scientific point of view to kind of help rebuild that skin and really increase the firmness and the tightness to the skin. Have we any other questions in there?
I think we are finished with the questions.
Maybe any questions from you, Pam?
No, I think we're good to go.
So we're going to replay this out.
We're going to say thank you as well. Thank you for joining us.
Pleasure to have you.
I look crazy. You do not. You look great. And to our amazing model, who was pleasure, really. We did good. Yeah, we did.
So we're gonna post this up later so you can watch it back or share with friends later. So as we're coming to the end of the live, type your DDC into the comments or into the DM, and that'll kind of set up the automation so you can join into today's kind of special celebration and enjoyment of our Morpheus treatment.
Super.
All right. Any questions? Fire away. And all Morpheus treatments start with the consult. So it's not just a book in and go. We need to talk about it and kind of go through things on an individual basis, because sometimes we don't need to do the full face, or sometimes it's a targeted area of the body, or sometimes it's just the lower face, or sometimes it's the lower face and the neck. So we can separate those kind of things out too if we don't need to say treat the upper face or the eyes. So send in your questions, and we'd be excited to meet you.